Hey guys, welcome back to the Pulling Curls podcast. Today on episode 246, we are talking about plus size pregnancy, considerations in pregnancy and birth. So let's untangle it. Hi, I'm Hillary, a serial overcomplicator. I'm also a nurse, mom to three, and the curly head behind Pulling Curls and the Pregnancy Nurse. This podcast aims to help us stop overcomplicating things and remember how much easier it is to keep things simple. Let's smooth out those snarls with Pregnancy and Parenting Untangled, the Pulling Curls podcast. Big thanks to today's sponsor, ABBYY Medical. For 30 years, ABBYY Medical Technologies has been dedicated to one mission, ensuring every mother and newborn goes home healthy. As one of the world's largest manufacturers of labor, delivery, neonatal, and gynecology devices, ABBYY has supported moms and babies with over 75 million devices sold globally. Their commitment to innovation and education drives them to keep advancing. Here's to 30 years of care and to many more for moms and babies everywhere. To learn more about their solutions, visit labbary.com/obstetrics. Okay, I am super excited for today's guest. She has been a board-certified OBGYN for 14 years. She currently practices in Oklahoma. She is passionate about education and advancing women's safety in healthcare and teaches around the country about these types of scenarios. I want to introduce today's guest, Dr. Tori O'Daniel. Hey, Tori, welcome to the Pulling Curls podcast.
Hi there. How are you, Hillary?
Good. So Dr. O'Daniel, but we're going to call you Tori because Dr. O'Daniel is just too hard this early in the morning.
That sounds nice.
So today we are talking about plus size pregnancy. And I got to tell you, so I had my appendix out like 3 weeks ago and I was reading the surgical report and it starts out with 48-year-old obese female. And I was like, my feelings were so hurt. And then I was like, it's just documentation, Hillary. He wasn't in there saying, God, this girl is fat. It's just that it took more to probably get through me to get to my appendix. It's just documentation. But I got to tell you, my feelings were hurt when I read it, which is so dumb, right?
Yes, I totally understand that. I think that we all come to the physician indexes in our life, and your history is going to come with that, right? So you're allowed to come with your feelings and feel all the feel.
And this is not meant to offend. There's so many ways that we can say it. Tori was saying that at her work, they call it a person of size, which I hope every person is a person of size, even those tiny little people, the newborns.
Right. Yeah. I mean, I think we're all just trying to make sure we're being inclusive and not exclusive and make people feel bad about their bodies. And I think one terminology that I've heard that I really, really like is living in larger bodies. So those of us living in larger bodies, I think that that's really appropriate and kind of allows you to identify what's happening, but doesn't make you associate with that as your entire identity.
Still hurts my feelings, though.
That's fair enough. Fair enough.
Yeah, so we don't want to be offensive. However we refer to it on this podcast, it's just people in larger bodies like she was talking about and some of the things you can experience and kind of how to work around those different things. That's what we're talking about today. And let me be really clear. I am plus size. I have a whole post on being plus size at Disneyland because there's different things that you have to approach like rides because you're plus size. So same idea here. We're just approaching it with our bodies that we have, right?
Sure, of course. Yeah.
Yeah. And I want to say it's not always about weight, right? Because some people are very skinny, but then have like a really big tummy. Or as we go into breastfeed, they have giant bosoms, right? And that can affect how we deal with them in all those different kinds of ways too.
100%. I mean, you really cannot associate somebody's difficulties or even their obstacles based on their body mass index or their weight, because it really just depends on how it's distributed throughout your body. And just like you said, you might be very thin and have large breasts, and then you're going to have to figure out how to appropriately breastfeed your baby. It's the same thing with your belly or your abdomen. I mean, you may lay back and it might distribute differently than somebody of the same size. So it's really important to take the patient as a holistic approach and not just based on their BMI.
Yeah. I don't think we didn't weigh people at my hospital when they got to the hospital. I think we just took whatever their last visit was because, who wants to be in labor? And you're like, just jump up here on the scale, right? No, no, thanks.
Yeah, yes. We routinely weigh people on admission on hours, but not always necessarily in labor. But if they're getting admitted to our antepartum service, so if there's some sort of a complication where their weight gain may really be impressionable for us, is for like, if they're preeclamptic and we're watching to make sure they're not gaining a lot of water weight, we'll do their weight when they get there.
Yeah. And I got to say, so I started labor and delivery in 2001. Tori, I think I was a little bit before you, but you were probably maybe in residency
Yep,
back
I was
then.
in residency from 2010.
Yeah, and I gotta say,
Yeah.
we had 0 things to deal with this. Like, we made up things, right? We used all of our foam tape.
Oh my
We
goodness.
used all of our all
Yes.
of the things at our disposal. Straps, many straps were used.
Yes.
But I'm so grateful, probably 10 years into my journey, we've started to come up with things like this. So Labry, the sponsor of this, podcast, has a thing called Traxy
That's
that
correct.
really makes plus size C-sections so much better than what we were jerry-rigging together, like MacGyvering
Oh my
in
gosh,
the OR
MacGyver.
back in the day.
Yes, everybody was MacGyvering and all well intended, right? We were just trying to make sure that the patient's abdomen was out of the way so we could actually appropriately and safely make that incision. But in doing so, I think we really just sort of fell short on people's feelings and having dignity maintained in those situations. And I'm so grateful that there are more devices and products there to allow us to do both, because that's really what we're after.
Yes. And there's another product called ABBYY that we're going to talk about later that they've
Yes.
developed that's even for after you have the C-section. So you guys might not have noticed a difference with how we dealt with things in the OR, although I would guess considering how much foam tape I would put on your belly
Yes.
back in the day. But there's even stuff that you can help to deal with your plus size body after you have your baby. And I think it's so awesome. I'm glad that we're coming up with innovations that make sense for things like this. Yeah.
Yes.
And okay, so we were kind of talking about in the OR and your lower part of your belly. There's lots of words that we use for it. Muffin top, right? Fupa is one of my patients' favorites. Apron, a lot of people call it an apron belly, like when we're talking about like what your body shape is, or a pouch. But in the hospital, we call it your panis. Not my favorite word. We have so many.
Yes. Yes.
But
Panis or paniculus.
yeah, so we have to get that up and out of the way in order to do a C-section. And it also can cause issues, with your pregnancy and things like that as well. So that's kind of what
Yeah.
we're referring to.
Yeah, yeah. So that area right where it hangs over is kind of right where your underwear line typically hits. So right above your pubic bone, where your hips, if you were to come from your hips into the center, is typically where we make that incision. And so if you've got what you referred to as muffin top or your fupa hanging or your apron hanging over, then it impedes me being able to make that incision where I would normally make it. And it also can impede when I'm delivering your baby. So getting it up and out of the way so that I can do this safely for you is really what our goal is.
Yeah. Okay, so plus size pregnancies in general, what are some things that those moms need to be on the lookout for during their pregnancy? Obviously, everybody needs to talk with your provider. Just a shout out. So many people are like, they don't need to weigh me at my appointments. Guys, it's important information, especially as you get going into your pregnancy. Like if you had a significant weight loss or significant weight gain, that makes us think about different things. So you don't have to look at it, turn around. I don't care. But weight is important during your pregnancy to be weighed and all that kind of stuff. But what do those moms need to look out for?
Well, just to backtrack for 1 second, I really think that it's important that what you just said, why it's important. So there's so much in society that's brought upon people living in larger bodies that really do feel such a sense of shame that comes with weight. And it's really important that your physician, your midwife, whoever's talking with you, your nursing staff when you're in labor and delivery or at the clinic, talk about the fact that your weight is not all of what we're dealing with, but it is a part of how we're going to take care of you well. And so if you don't want to look at it, that it's perfectly fine, but it is going to affect the way that I care for you. And some of those things that we think about as we go through that labor and delivery process is that I am going to be monitoring your baby while you're in labor. And we use these external monitors to get that monitoring to watch your baby while you're in labor. And if you have redundant or excess tissue on your abdomen, it's harder for me to do that. And so I don't think we talk about that enough and what that means for me to be able to monitor your baby to make sure your baby's safe. And so you're more likely to have your membranes ruptured as soon as we can rupture them so that we can place internal monitoring in there to monitor your baby safely. And I don't have to use that external monitoring. You do have a higher risk for diabetes and hypertension throughout your prenatal care. So we're going to be watching that pretty closely. We check your blood pressure every time that you come into the clinic, and then based on your history and also your size, we might do an early screening for gestational diabetes. So that means you'll have that sugary, lovely orange cherry full grape whenever we offer you to do that screening earlier than that typical 28 weeks. And then you can also have something called labor dystocia, which kind of slows down that process of labor as we're watching that labor curve and we're making sure that your cervix is dilating in labor.
Yeah. I mean, there's a lot of things that we're watching for. Side note, if you're plus size and you're early in pregnancy, please be sure to talk with your provider about aspirin in pregnancy, because I'm still surprised by how many people are not being offered aspirin in pregnancy. You can look at that podcast
Yeah.
episode I referenced earlier.
Ah, preach it. I love it. Can we like reference it and put a little asterisk so they can click on that for here? Because yes, aspirin for sure.
Yeah. So preeclampsia, GDM, all of that leads to, and I got to give a shout out for monitoring, because, you know, baby has a little bit more room to, not more room to move per se, but more room to like get out of my monitor as I'm trying to put it on. And so we're just in there adjusting. That is our job as a labor and delivery
Mhm.
nurse. Like, I'm constantly in the room adjusting. So don't feel bad. You can always offer to hold it though. You can offer
Yes.
to find it on your own. Like, I've had a lot of patients who are like, no, I'd much rather get it on my own. It is not like a licensed professional skill. A lot of it is just like tilting it. So,
Mhm.
great tips.
Yeah, and your position, just like you said, holding it, but also the patient's position really can help. We have wireless monitoring that sometimes works really well as well. And so I encourage you to be an advocate and be a part of that because, like you said, delivery nurses are in there adjusting all the time. And so we want help from the patient for sure.
Yeah. And I should also say, sometimes on super skinny ladies, it's also a problem because like their blood
Yes.
vessels get in the way. Like, everybody has their own,
Okay.
everyone's a problem in labor and delivery. Except they're not.
That's
We
the
love all
best.
of them.
Yeah, we love laboring patients, but there are obstacles, and the obstacle is not always somebody's weight,
Yes.
you know. And so I always encourage. I feel like I just try to be as open minded as I can and talk to somebody like I would expect them to talk to me about whatever it is that my clinical presentation is being brought to them. And so I talk about the things that we're going to change or do differently based on what they're presenting me with, and that doesn't always mean weight, but weight is certainly a part of that. And so I don't shy away from talking about it because I want to make sure we're all on the same page.
Yes. And because we were talking about preeclampsia, diabetes, it can lead to an early introduction. Those people are at a higher risk of C section, right, Tori?
That's correct. Yes, 100%. Because if your cervix is not favorable, or if you're a little bit more preterm, it takes us longer to get you into that induction process into active labor. So you are at higher risk for having a primary C section because of that early induction.
Yeah. So also get on aspirin. Just a second plug for aspirin.
We just every few minutes we'll just like plug in aspirin and mention it.
Yeah. And the thing is, we would do these C-sections on these plus size mamas, right? And I would be like, oh, I hope that girl does okay, because if you are a plus size gal, think of the C-section being kind of where that panis folds, right? And so
Mhm.
a lot of times these moms would go home and I'd be like, it's going to end up so moist. We all know that like those areas that fold get more moist.
Yes.
That's a breeding
Yes.
ground for bacteria. There were all these different things. And of course, when Hillary had her baby in 2000, they were like, baby will be born. It will be sunshine and rainbows and you'll live happily ever after, right? And we've learned that is a
A
lie.
lie. All
But I think
lies.
we were doing that to these poor plus size moms, right? You'll be fine. It won't be any problem. But there is a new thing called the ABBYY that can help you take care of your postpartum body plus size, or even if you just have that belly that hangs over, because skinny girls can still have a muffin top that could be
Yes.
problematic.
Yeah, I mean, the other thing that people call it too is that shelf, right? I mean, with the shelf commentary or discussion about after having a C-section is all over the mommy blogs and podcasts and things like that, talking about the frustration with that shelf. But you use Traxi. So as a physician, I use Traxi in the midst of the operating room to make sure that I had easy access and I'm performing this procedure safely. But I want to give you the tools as the patient to maintain advocacy for yourself and help me help you in your postpartum care. And so many women ask me about how can I participate in this care? And before having something where I could really lift this redundant tissue off of that incision site, I was also MacGyvering it. I would tell them to use a pad to put the absorbent side of the pad against the incision and let their belly hang over so they could wick away that moisture, or a sock or a piece of fabric or a cloth. Like, I mean, there's things like that that we just try to help our patients. So the Abby really is so helpful for me post-op, and it's helpful for the patient because we get to work in tandem to take care of this patient at hand. The Abby is this sticky-like material, almost what I describe as a window cling that can lay on their belly right above their incision, and it lifts that redundant tissue off of that incision and allows air to get to it. And often my patients find that when I'm placing the Abby on and give them that compression, they also get comfort from that because it causes that compression that you're feeling and it really allows the air to get to it. So I can see the incision, I can make sure that it's healing like it needs to, and they are allowed to adjust it. Like they can pull it up and adjust it however they wanted for 2 weeks after their delivery.
Yeah, which is awesome.
Yeah.
A lot of you might be thinking, I've heard about binders. So we've used binders
Yes.
as long as I've done labor and delivery, which is kind of like, I mean, it kind of looks like a tummy trainer, although it is not going to make you skinny. I've had so many patients
Right.
that are like, "Oh, I want that binder because I want I don't know what it thinks it's going to do to your uterus, but I want my waist back." And I'm like, "Girl, that is not going to get you your waist back."
Yeah.
And they have been really helpful. Like I love a binder. Usually what it does is just kind of keep your uterus in place, especially when you're standing up. It's not wiggly wobbling around that incision, but it has some cons as far as it doesn't really hold up the belly like
Right.
the Abby, and it's hot.
Yes.
Being in Scottsdale, it's hot. People don't
Yes.
love that part. And actually, a binder and Abby can be used in tandem. Like if you like that really like tucked in feeling of your uterus in place,
Mhm.
because people who have had a C-section or a V delivery will find that their uterus just feels like big.
Yes.
It feels bigger than it should be because it's still like what, 5 months pregnant
Yes.
after you have the baby?
Yeah, everything feels out of place after you've had a baby, and it does not matter if you've had a vaginal delivery or a C-section. Everything feels exhausted and tired, and they do a marathon, and we don't give patients enough credit dealing with this. But the beauty is that you want to have as many tools in your tool belt as you can to help your specific situation. So what you said is just spot on. It's just how I counsel patients. If I place the Abby and I lift and I can see and they still want a little bit more compression, then I can put a binder on top of that. The beauty of the Abby for me as the physician helping the patient is that the binder typically used alone, it compresses and it gives that great compression that you're describing, but it compresses that redundant tissue down onto the incision, which then can also cause pain. And if it shimmies while they're in bed, then the bottom part of that abdominal binder, the edge of that, then kind of folds into the incision and then it compresses right on that incision itself and it hurts a lot. And then the other problem is that it's hot, but it can also get really dirty. You know, you sometimes can have some fluid that leaks around your incision or you're sweating right on your back. And if it's around there and it gets dirty, people don't love using that time and time again. The Abby, that material is hydrophobic and it's also really super sensitive. So it's hypoallergenic and it can be used again and washed. So you can actually use soap and water, wash it off, and then pat it dry so that it retains its stickiness to do both. So they can use it throughout the change in their body, right? As their uterus compresses down, and then they can keep using it and just adjusting it.
Now, the tricky part of these is you can buy a binder on Amazon, and most hospitals offer a binder, although
Uh huh.
not all of them. In fact, the hospital I most recently worked at wanted cash at the bedside for
Oh
a
my
binder. Like if a
gosh.
patient requested the binder, it was 20 bucks. I guess we took credit card. I'm guessing we didn't take cash. I never had a patient who was like, "That's an excellent idea." I was kind of like, "Or you could get it on Amazon
Yeah.
for maybe cheaper."
I've never heard of.
But the Abbey, I know, I know.
Okay.
I didn't work at like a super trashy hospital too. Let me just verify. I previously worked at a much scarier hospital that gave away binders. But
Okay.
the problem with the Abbey though is it is a medical device. So this is
Mhm.
something that your hospital orders and the
Yes.
hospital has it. It's not something you can get on Amazon yet.
Right.
Hopefully someday soon.
Right. Fingers crossed.
But what's the best thing, Tori? If people are hearing this podcast, they're like, this is an excellent idea. What should they do?
I think they should ask their physicians about it or their midwives. So, you can start asking and talking. And I really encourage patients to start asking and talking about their labor and delivery and postpartum process in their clinic, which a lot of providers are doing nowadays. They're really kind of focusing on what the expectation is when you talk about your birth plan. There's lots of jokes about birth plans about, oh my gosh, this evil birth plan. But I really love a good birth plan so that we can talk about what your expectations are and I can clarify what things are possible. And in that conversation, you can say, if I end up having a C-section or I know I'm having a repeat C-section, I've heard about this device that I really think can help me as far as improving in my postpartum advocacy for myself. Do you have access to this? Can you offer this to me? And I really encourage patients to ask about it.
Right. And I was just thinking sometimes a company getting into the hospital is the hardest thing, right?
For
Because we're
sure.
full of Baxter. Like
Yes.
Baxter gives us
Yes.
everything at the hospital. But I think the vast majority of hospitals will have this Traxa unit.
Mhm.
So Labry is already in with the
Yes.
Traxa unit. So you could tell your provider if they're like, I've never heard of this Abby,
Yeah.
you could say, oh, it's by the same people that
Yep.
do the Traxi. And then they'll be like, oh, great. Let me talk with the manager the next time I see her.
Yep.
And they can see if that's something they can order in for your surgery or for somebody down the line, because they might not get it in for your surgery, but by asking about it, it helps hospitals know that this is something people would like.
Yes.
Shocking.
Yep.
And they can order it for,
Yeah, and I actually really like the combination of using the 2. I like having the track seat in the OR for me to be able to use, and then we really clean off and wash the patient's belly off afterwards, so I love taking it off and kind of letting the abdomen sort of lie when we clean it off, and then when I get to use the Abby, then I teach the patient how to use that, so I highly encourage the patient to ask, and I think you're 100% correct that most of the time when they have one product from a company in there, it's a little bit swifter to get it into the hospital. So ask. You can't hurt to ask for sure.
Yes. And one thing I forgot, I was thinking about this is like the general population doesn't understand how good air is for
Yes.
wounds.
Yeah.
I think we all think, oh, it should be covered up, right? Put a band aid on it immediately. Leave that band aid on until you can see the band aid forever on your finger, like my kids do, right?
Yep.
But air can be really healing for
Yes.
wounds. And so that's one of my favorite things. When I saw the Abby at the A1 conference, I was like, oh, that is genius,
Yes.
because when it's in that moist, closed in environment, that's just bacteria opening up the incision. Sad news, they can reopen, which is not, you're
Never
not looking for
fun.
that.
Right. Right. Yeah.
Yeah. So
Yeah. This.
air is important.
Yeah. 100%. I mean, I just cannot stress that enough. You're trying to give your incision the best environment to heal, and the way to do that is to decrease your moisture and allow air to heal on its own. And so allowing that redundant tissue, that fupa, that muffin top, whatever we want to call it, to get out of its way, it decreases that, you don't have that friction from your belly hanging over that. It really just gives it the environment that I'm trying to get anyway. It's what we were MacGyvering, when we were trying to get rid of all of that moisture. It's giving it that environment to do that. And then when I'm coming to look at it in the hospital, and also when you come into a clinic, and review or kind of evaluate the incision, I can see it a lot better. I mean, a lot of patients have discomfort when you go to lift their belly initially to get it
Mm-hmm.
off of the incision. And as a nurse, you have a binder on and somebody has a binder, you walk in, you're like, I need to peek at your incision. And you go to release it, they like hold on to their belly because it hurts so bad. And this kind of takes that away for them, which is really nice.
Yeah. So obviously, what we always take away from the Pulling Curls podcast is do not be afraid to ask questions. Don't be afraid to ask your provider if this is something they offer or could offer at your hospital. And don't be afraid to ask questions about postpartum or your birth plan throughout all of pregnancy.
Mhm.
And don't be afraid to say, hey, I know I'm a plus size gal. What kind of things do you foresee? What kind of things could I be doing? Are there exercises that I could be doing that could help my body get into labor more? Talk with your provider. We don't want to fire hydrant you with information because we don't actually know what you're interested in knowing. But when you ask questions, most providers really want to give you all the answers that they can.
And also talking to your provider, your physician, your midwife about maybe some of your issues that you might have shame around is really eye opening for us too, to be sensitive to the things that are really important to you. And I just think we underplay communication so much. We're all on a time constraint. And I feel like this podcast is like re energizing that. You have to talk, you have to advocate, you have to ask questions, kind of tell me where you're coming so I can meet you in the middle. And I would love to do that with really anything, and especially your postpartum care.
Yes. Okay, Tori, thank you for
You're
coming on.
welcome.
Thank you, Labbery, for sponsoring such an important episode to talk about these important things, because healing postpartum is just as important as what happened throughout that whole pregnancy and labor.
Yeah,
So let's not forget it anymore.
I agree. And aspirin. Aspirin. Ah,
Aspirin to reduce your
what?
chances of
The
preeclampsia.
preeclampsia.
Don't forget to talk with your provider.
Yes, for
All
sure.
right, Tori, have a great day. Thanks for coming on.
Thank you so much. Take care.
Okay, I hope you guys enjoyed that episode. I know that this can be difficult to think about, just like Hillary reading her OR notes, but it's really important that it's a consideration that you have throughout your pregnancy and postpartum. So I'm so grateful that there are companies like ABBYY who've created the ABBYY that can help you heal better after you have a C-section. And big thanks to Dr. O'Daniel for coming on the podcast. That was a fun conversation. Stay tuned because next week we're actually talking about my appendicitis, so you won't want to miss that episode. And then the week after that, we are talking about exercise in pregnancy, which is important for everyone, so stay tuned. Thanks for joining us on the Pulling Curls podcast today. If you liked today's episode, please consider reviewing, sharing, subscribing. It really helps our podcast grow. Thank you.